All right. Hello, everyone, and welcome to our and hopefully your favorite time of the week, the Pandemic in Philly COVID Conversation Series podcast. Where we are here to support community health workers and frontline staff by providing up-to-date information on the COVID-19 pandemic. I'm Kevin Leacock, everybody, and I'm joined by my co-host, Kelsa Lowe. Hey, Kelsa, to discuss COVID-19 updates. We're recording this COVID-19 update session on November the 2nd at 11 a.m. So, Kelsa, off to you.
All right. Well, some news, just going to jump right into it. Last week, the FDA expanded the use of the COVID-19 vaccine booster shot for certain populations. This list was expanded to include those who are 18 years and older with underlying medical conditions as well. So that's phenomenal. The vaccine distributors in the US, Moderna, Pfizer, and J&J are all eligible for boosters, which is fantastic. However, the CDC recommends that everyone 18 and older who received the J&J vaccine 2 or more months ago receive a booster shot, which is a little bit different from the other vaccines that recommend a booster shot 6 months after your second dose.
Got you. And besides boosters, that's of course one of the major talking points. The second major talking point that people have been asking about from almost the very beginning of this thing, like about kids, about our favorite kids, right? 5 to 11-year-old. So on October 29th, the FDA authorized the Pfizer vaccine usage in ages 5 to 11. So for the Pfizer vaccine, it was found to be 90.7% effective in preventing COVID-19 in this age group. So the vaccine safety was studied in about 3,100 children, ages 5 to 11, and no one posed any serious side effects in that study. And in order to offer the vaccine to the population, right, first the ACIP expert committee must approve the recommendation, and then the CDC will make the final decision, at which point the Pfizer vaccine will become readily available to children 5 to 11. And just really briefly, I read an article from the New York Times this morning, and they said that shipments are already starting to come over to the US. They're trying to do their thing, trying to get it going. But they did say that it seemed like it won't be up to at full strength until the second week in November. So I think there's still a couple more steps and hurdles to kind of jump over, but we're like at the point where that age group can then start being vaccinated. And then of course it'll be on to the parents and school administrators to like kind of make that happen.
That's great. Yeah.
Yeah.
I feel like even the second week of November is.
I mean, that's next
like,
week. So that's,
yeah,
I mean, it sounds, it may sound far. Yeah, but it's literally next week. So yeah.
Yeah. Well, it sounds like we'll get that ball rolling here pretty soon, which is really great.
Mm-hmm.
And other more local news on October 29th, so the same day that the FDA authorized Pfizer vaccine, on October 29th, the school district of Philadelphia announced that all student athletes must be fully vaccinated against COVID-19 in order to participate in school-related sports, which is, I think, really great. I think it's important to be able to protect our kids, protect their family members and the folks that they're in touch with. And also, failure to comply with this will result in their ineligibility to participate.
Well, one thing real fast, Kelsey, sports, as we mentioned before with Dr. Baston, sports is very important. So I just want to put that out there to like make people do things. So I think that's super important that the student athletes must be fully vaccinated to do anything in the school district of Philadelphia. So yeah.
Yeah, definitely agree. And I know that there's been a lot of talk about, we definitely want to like be in the know of, whatever side effects come out of the vaccine. But I think another conversation that's been ongoing are the long-term side effects of actually getting COVID, the disease. So there's a lot of long-term studies being conducted on the long-term health ramifications of COVID-19. So I think that'll be an ongoing conversation as well to just kind of keep in mind and keep folks aware of as we're having these conversations.
Yeah, no, for sure. I mean, and talking about long-term ramifications and just talking about data, things that we've seen throughout, since vaccines were like readily available for our population, the data remains consistent, right? So the vaccines remain the best way to protect everyone from the virus, right? So in fact, just recently we saw this data that says that people who are unvaccinated were 11 times more likely to die from COVID-19 than those who were fully vaccinated. Now that's a lot of things. Like that's not 2 times, 11 times more likely. Like to me, that's a lot, right? And also unvaccinated folks were 12 times more likely to be hospitalized with COVID-19 compared to the vaccinated counterparts. So once again, the numbers kind of bear it out. Also, anecdotally, it kind of bears it out. Like, I think all these things kind of show that being vaccinated is our best tool in our toolbox.
Oh, absolutely.
Yeah.
And it's here and it's accessible and it's readily available
Right there.
and we have access. Like, I'm super ready to get my booster. So
Yes.
let's go for it.
Almost time.
Just gonna like share some data quickly with folks. It's been a minute since we shared some data. So kind of jumping right into the US population, 57.9% of the US population is fully vaccinated. In Pennsylvania, 60.4% of the population is fully vaccinated, and locally in Philadelphia, 66.1% of Philadelphians are fully vaccinated. And this data is for 12 and older as well. So just the population that is able to be vaccinated right now. Those are the percentages.
Creeping ever so slowly to that mark, right? Well, whatever that,
yes.
I feel like we've been in the 60s for a while. Hopefully one day we'll reach stats and it says 70% one day soon.
Yeah.
But yeah, and just really briefly, and talking about some of the things that are available to, healthcare workers and messengers and things like that. There was a resource that was put out there from the Public Health Collaborative on 10/26, and it really is just like a toolkit for the COVID-19 booster dose messaging and outreach tools. So this tool will be linked at the bottom in the show notes, talking about this toolkit, which contains top line talking points. It answers any tough questions. It has sample social media posts and graphics that can help healthcare workers answer questions about COVID-19, vaccine booster doses, and support the local vaccination outreach. So I just think that, anything that we're doing, like any kind of toolkit to help us be more strategic and targeted in our messaging, it helps out. So this is the one that we kind of saw that can really, anyone who's on the line now, who's a healthcare worker, can really utilize in their day-to-day work.
Yeah, I think also as we kind of inch closer to the 5 and 11 age group, being able to receive their vaccines, other toolkits will become available for those populations as well to help parents answer questions and help them feel more comfortable and support them and, whatever they need. So we'll be sure to kind of keep tabs on what other updated toolkits come out and share those as well as they come up. But otherwise, that's the time we have. Looking forward to hearing from everyone in the meantime, and we hope to see you back with us November 11th. We'll be joined with a reverend in Philadelphia to discuss religion's role in times of COVID-19. All right, everyone, remember to stay masked, promote social distancing, and get vaccinated. We're here to spread the word, not the germs. Thanks, everyone.
Our team wants to hear from you. Click the link below to share any questions or comments you may have that we can address on our next episode. This series is brought to you by the National Nurse-Led Care Consortium, a nonprofit member organization working to strengthen community health with funding provided by HRSA and the CDC. Updates in COVID-19 response is changing rapidly, so please consult your primary care provider for personalized medical advice.